Good evening, dear colleagues. First of all, my gratitude to Pushpanjali Study Circle, Pushpanjali Medical Center, and particularly my senior brother, Dr. Vinay Agrawal, for giving me an opportunity to speak my mind on the legal perspective, legal issues in medical practice, current perspectives. Dear colleagues, gone are the days when we were treated like gods. In these days of Consumer Protection Act, social media, and consumerism, one has to have knowledge about legal issues. I'll be touching very briefly and comprehensively to make you more knowledgeable, comfortable, and safeguarded about the legal complications while practicing medicine. Few slides for your critical evaluation and appraisal. जैसे कि मैंने पहले कहा, हमारे लिए ना सो कॉल्ड नेग्लिजेंस वर्ड एक हवा बन के रह गया है. मैं समय कुछ कम लूँगा बिकॉज आई नो लॉट्स ऑफ यू हैव द इवनिंग मेडिकल प्रैक्टिस. मुझे भी जाना है, तो बहुत ही कॉम्प्रिहेंसिवली एंड वेरी ब्रीफली आई टच, बट आई प्रैक्टिकली I have prepared these slides very passionately, full information, complete information. Why is working legal knowledge important for a medical practitioner? In this socially connected and right conscious, mind it, we have become much more right conscious, consumer-centric world. Every doctors need to be aware of legal knowledge apart from medical expertise, making it the best safeguard against litigation. Ignorance is not bliss. You have to have information. Every doctor needs to be circumspect about patient intentions apart from usual nitty-gritties of patient's body language of patient and attendants. The moment your patient enters your nursing home, your clinic, your hospital, you know it, what he could end to be. Agenda: introduction, understanding legal responsibilities, recent trends, legal framework governing medical practice, jury's perspective, doctor's perspective, and believe me, डरने की जरूरत कभी होती नहीं है. If our intentions are right, we at DMC are receiving far bigger number of cases these days. But if your intentions are clear, DMC is your friend always. What are the options before a complainant? The State Medical Council, which is Delhi Medical Council, which has inbuilt complaint redressal mechanism. Every complainant has to go through 3 steps: the Executive Committee of DMC, Disciplinary Committee, General Council, and then the order is passed after careful deliberations, keeping in mind the inherent complexities in medical practice. No one is better aware than your people at DMC. Apart from DMC, we have the National Medical Commission, Consumer Forum, Civil and Criminal Courts, National Human Rights Commission, Police. थोड़ा सा बताते हुए, medical practice involves diagnosing, treating, preventing, and managing diseases. Legal implications arise when patient care deviates from accepted medical standards. Doctors are legally bound to provide care adhering to the principles of duty of care and medical ethics. Every word is carefully written, so please. Importance of understanding legal responsibility for doctors. Awareness of legal obligations helps prevent legal liabilities and maintain ethical standards. Protects both doctors and patients by promoting safe, transparent is the real word, and fair medical practice. Equips doctors to make informed decisions in complex clinical scenarios. Encourages documentation and communication. In medical practice, as far as the legal perspective goes, documentation and communication are the 2 key words which practically end up the whole thing. I already said that there is an increase in medical negligence cases all across India. More patients are aware of their rights and access to legal remedies. Our own colleagues at times and the other Samaj, उसमें सब है. It happened in the Western world, it is happening in Indian also. CPA influences. Doctors are increasingly facing cases under CPA provisions. Growing role of social media. आज की तारीख में कुछ भी होता है उसको मिनटों में बाहर आ जाता है. People have their own impressions. Complaints, grievances often escalate quickly online, influencing public perception. What do we do in DMC or in other courts? Use of medical expert testimonies. Judgment rely heavily on medical experts to determine negligence and malpractice. Emphasis on informed consent. Informed consent, I think, is the biggest remedy, biggest kavach for any such case protecting against any negligence. Lack of proper consent remains a leading reason for negligence claims. Rising defensive medicine. Fear of legal repercussions is leading to over-testing, over-treatment. It happened in the West, that's why the costs are so high. And the same experiment is being extrapolated in Indian conditions also. Few things, the legal framework, the law of torts, few words you will come across my talk, they are extremely important. The law of torts is a branch of civil law that deals with situations where a person's actions cause harm or loss to another, leading to legal liability. In the context of healthcare, torts law governs cases where healthcare professionals' actions or omissions cause a damage. So this is Indian Medical Concept. We have our own Delhi Medical Concept 1997. CPA 2019, the latest amended. We have been trying, our sessions and council have been trying to bring out the medical profession out of the ambit of Consumer Protection Act, but so far we have not succeeded. The IPC, now which is called Bharatiya Nyaya Sanhita, MTP Act 1971, the Clinical Assessment Act, as we all know, till now Delhi has not come in the affidavit. The previous government defended us, and hopefully this tribe government also will try to either not bring us in the ambit of this act or modify it suitably so that we are not covered. Otherwise, if it happens as we know it, practically most single doctor clinics and many of the small nursing homes may face closure. The Transplantation Act 1994, the PCPNDT Act 1994. So who decides and how do we decide? The jury's perspective. The standard of care refers to a level of competence that a reasonably skilled doctor in a similar field would provide. Mind it, no jury can judge you to be the best performer. You only have to be an average performer according to the prevalence, what is prevailing. Deviation from the standard of care can result in a finding of negligence. Breach of duty, whether the doctor deviated from the accepted medical standards, the jury will look into two parameters to decide whether the duty care was performed as per expectations, reasonable degree of skill and knowledge, and reasonable degree of care. Factors concerned while determining negligence. Reasonable degree of skill and knowledge do not, extremely important, some of the practical suggestions I would like to say, do not flaunt or display qualifications not recognized by National Medical Commission. Do not claim a specialization and superspecialization which you cannot back by recognized degree. I think many of our colleagues are doing these mistakes, being an MD medicine and openly saying cardiologist or diabetologist. I think they need to be careful. Never go beyond your knowledge and skill in handling the patient. Balancing patient's rights and doctor's discretion. Ensure that the patient's right to safety, informed consent, and fair treatment are upheld. At the same time, decisions often acknowledge the complexities and uncertainties of medical practice. May consider whether the doctor acted in good faith and exercised reasonable judgment. Anyway, if your intentions are right, you are following the right victim, I'm sure negligence will never come near it. The litigation will never come near you. Communication and documentation, already said that, believe me, if you spend a good amount of time with your patient in the first go, or even if a mishap happens, you share your views with the patient. This is how it happened. What happens is, in our flair to save our skin, we either tend to escape or we do not reveal. I think this is the worst thing we can do. Communicate, first document, and second communicate. Few landmark judgments, I'll quickly go through it. Jacob Matthews versus State of Punjab, a patient died due to alleged medical negligence. So 304A IPC was convicted. Doctors are liable for criminal negligence only if it is gross and amounts to recklessness. Few words which are grossly used. One is gross negligence, a severe lack of care or competence that goes beyond ordinary negligence. It involves conduct that disregards the safety of patients, demonstrating a blatant breach of duty. Recklessness, acting with a conscious disregard for known risks. In medical practice, then this can include making decisions without considering patients a potential harm to the patient. One word which you'll increasingly come across is BOLAM. What is BOLAM? BOLAM test, a legal standard used to determine medical negligence. According to this test, a doctor is not negligent if their actions are consistent with a practice accepted as proper by a reasonable body of medical professionals skilled in that particular field. You would say, what was BOLAM? BOLAM was a patient. This reason was given in 1957. He was a patient at mental health institution managed by this Fran hospital. He underwent ECT, electroconvulsive therapy, without receiving muscle relaxants or physical restraints. During the procedure, he suffered severe fractures. The court found that some doctors, very important, some doctors at that time did not consider muscle relaxants necessary in all the cases. Since the doctors followed a practice that was supported by a reasonable body of medical opinion, they were found not negligent. We'll come again what went later on. Another judgment is Patrick Bolitho. The judgment ruled that even if a body of medical opinion supports the doctor's decision, the court must be satisfied that the opinion has a logical basis. This means the courts can reject medical opinion if they are not reasonable or defensible. Bolitho introduced judicial scrutiny into the BOLAM test. It came after the BOLAM, ensuring that the medical opinions must withstand logical analysis. You would ask me what this Bolitho was. Bolitho was a 2-year-old boy who suffered respiratory difficulties. He was admitted in this hospital despite signs of worsening breathing difficulties, no senior doctor attended to him. He subsequently suffered cardiac arrest and leading to a severe brain damage and later death. His parents sued the health authorities for medical negligence, arguing that appropriate medical intervention such as intubation would have prevented the outcome. So it's important to learn this. Few more cases quickly. This is Kunal Saha versus AMI Hospital. You must be knowing this. This was a corporate negligence case, and a very big penalty was given to that hospital. Another landmark case, Samara Kohli versus Prabha Manchanda. The patient underwent a hysterectomy without proper informed consent, thereby emphasizing the concept of informed consent and a patient's right to self-determination. Mind it, the patient of today is an informed patient, is a right-conscious patient, and he is a consumer-centric patient. He knows he has lots of choices. So, few definitions. Consent and informed consent is the center of whole thing. Consent is a voluntary agreement of a patient to undergo a particular medical intervention. It is considered valid only when the patient is informed about the diagnosis, proposed treatment, assured risk, benefits and alternatives. Informed consent ensures that the patient makes an educated decision about the health care. The express consent, implied consent, you know it all. A few things. Exceptions to consent: the medical emergencies, unconscious and incapacitated patients, and legal authorization by a court or a legal body. What is contributing negligence? This is what comes to the doctor's defense. If a patient does not comply with the suggestions or advice given by doctor, then it is a contributing negligence which can be alleged against the patient. For example, not taking prescribed treatment, not keeping follow-up, non-compliance about investigations. So it is advisable for the doctors to write full restrictions on prescription paper, discharge card. I know of one case, only wrong discharge given to a patient, and the patient is again alleging negligence. So where does the burden of proof lie? A complainant comes, the onus of proofs is on the person alleging negligence, that is the patient or the attendants. This burden shifts to a defendant, for example, doctor, or where there is no free access to the patient, as in OT and ICU. What is vicarious liability? It is very important. Rekha Gupta versus Bombay Hospital. This case highlights the principle that hospitals may bear responsibility for the action of their consultants also, especially when the financial arrangements indicate a direct service provision. Very important for our doctor friends. I am speaking to our colleagues. The doctors' perspective, challenges faced by the doctors, fear of legal action leading to defensive medical practices, increasing instances of patients' dissatisfaction and aggressive legal body actions, media trials, very important, difficulty in maintaining comprehensive medical records amidst high load work. We know of lots of consultants, they have many places to visit, so it becomes difficult, the documentation and proper communication, which is an absolute must. Importance of documentation, very, very important. Patient's medical history, informed consent forms, diagnosis, treatment, progress notes, discharge summaries. If you have all this, you have nothing to worry. So, importance of documentation, don't be lazy, don't be casual. The moment you walk into the clinic, I know lots of doctors who are, even before listing the patient's history or whatever, the treatment is already given. I think don't do that. You are landing into trouble. Don't be lazy, don't be casual. Not documented means not done. Sloppy documentation means sloppy care also. Communication and transparency, effective doctor-patient communication. We keep saying the relations no more remain the same. The onus is on us to maintain good relations. If you inform the patient properly, I'm sure no harm will be done. Disclose treatment options. होता क्या है in the race to become better, मेरी कभी ज़्यादा सफेद होनी चाहिए. We tend to go ahead, and that's where we go wrong. In case of medical errors, honest communication and apology. Most big hospitals, corporate hospitals, have started having the post-discharge or post-whatever bad outcome. They brief the whole family, everyone. That helps a lot. Communication and transparency. Try to talk to in patient's language, engage the patient in a dialogue at the end of consultation. Always ask patients, if you missed a patient, if you have any more questions to ask. So, अक्सर क्या होता है, पेशेंट बोलता नहीं है, आप उससे पहले इसको इंटरप्ट करते रहते हैं. Don't interrupt. Appear to be in a hurry, even if you are in. Start examination and then write a prescription, not the other way around. So, professional indemnity insurances, you all are aware. Continuous learning and awareness, stay updated on amendments to medical laws and landmark judgments, attending CME's programs on medical law and ethics. General instructions, last 2 threads only. Ask for colleagues, help लेने में आपकी इज्जत करनी होगी. This is an interconnected world. If you are not able to do it, don't, उस केस पे बैठना नहीं है, उसको kindly tend to refer away. Keep knowledge updated, preserve records, give guarded prognosis. These are not the days of heroism or voyeurism. These are days to perform one step better. These are the days to fall into a system which helps us. Another important thing, do not employ unqualified persons. We know we are, just to cut down the costs, the small nursing home resort to the practice of underqualified, even BAMS, BUMS, etc., etc. I think you have to be careful. Recommendations for doctors, records, obtain clear and informed consent, foster open and transparent communication, stay within your area of expertise. ज़्यादा तीरंदाजी दिखाने की गुंजाइश खत्म है आज के बाद. Keep up to update on legal developments, consider professional indemnity, collaborate with legal professionals when faced with complex medico-legal issues. अगर कुछ हो ही गया है, do not panic. मौत नहीं आ गई, कुछ नहीं होगा. Everywhere, if your intentions are right, if your methods are right, you have nothing to worry. Attend all cases personally, take due cognizance and reply in time, inform insurance company, consult medical experts, do not give unnecessary details, do not tamper with or manipulate with notes. Everything gets caught. Produce affidavits of colleagues and expert witnesses, give reference from standard textbooks. So dear friends, final thoughts. While legal challenges in medical practice are inevitable, understanding legal principles, practicing defensively without compromising patient care can significantly mitigate risks. Upholding medical ethics, exercising empathy, maintaining professional diligence are cornerstones of both good medical practice and legal protection. Ultimately, a well-informed doctor is empowered to provide better care while navigating the complexities of legal system. So, it is not only what we do, but also what we do not, for which you are accountable. Very important. Inaction can have as much consequence as a wrong action. As doctors, understanding legal responsibilities is as vital as medical expertise. Thank you, everybody. Thank you.